Reflecting on the content that we've gone over this semester, we've learned about communicating more effectively about health, listening more effectively in concerns about health, and critically assessing health messages. Overall, understanding health communication is so multifaceted and it covers so many topics that it makes communicating the best way in a general sense almost impossible. I think the most significant challenges related to communicating health may be time, health literacy, and lastly followed by a lack of patient empowerment. This semester we learned a doctor spends an average of 8 minutes per patient. Seems like a significantly short amount of time to figure out why a patient is there, what they're wanting to achieve, and what they're willing to commit to make that happen. And that doesn't take into consideration any language barriers that might be happening, any health literacy issues, or general embarrassment about a topic. According to Athena DePrue, health literacy refers to an individual's ability to access health information, understand it, and apply it in ways that promote good health. Unfortunately, there are many barriers that seem to interfere with all of those things happening. An example of the miscommunication that we discussed is a mother who gave her child 3 tablespoons of cough syrup instead of 3 teaspoons. This was 9 times the amount that she was supposed to be issuing her child. Lastly, tied in to both of these other things, time and health literacy, is patient empowerment. Patient empowerment is a problem because oftentimes people take a very passive role in their interactions with healthcare providers. This means they may not only be not understanding what the doctor is saying, but they're not even invested enough in their own health to be able to change it. One of the most significant strategies to enhance communication within a healthcare context is for healthcare professionals to take a biopsychosocial approach. This perspective takes into account people's physical conditions, their thoughts and beliefs, and their social expectations. An example of this can be a patient that comes in who's obese. It would be very important to take into consideration their culture, so what they're eating, what they're around, what they're able to actually change in order to address the issue that they came in for, whether that was being overweight or some other factor that plays into obesity, not just the fact that they're obese and that they need to lose weight. Another strategy to improve communication within a healthcare context is to require healthcare professionals to take healthcare communication courses. Lastly, using collaborative medical communication when engaging with patients will enhance communication within a healthcare context. By having both the patient and the doctor engaged and equally collaborating on a medical issue, it ensures that both sides are invested in the long-term goal. I think the single most important thing that I learned from this semester is to be an empowered patient and to advocate for those around you that may not be empowered patients. Regardless of what a doctor tells you, prescribes you, or helps you through, it's still 100% your responsibility to be invested in your own health and be an active participant in whatever you're doing. While we spent a significant amount of time learning about health message constructs and health messages in the media, I still feel like it's difficult to understand. There are so many different things to address when looking at health messages and also creating them, like what we researched on smoking and HIV and the stigmas still associated or not associated after those campaigns were run. It's very intriguing to think about health issues that are not addressed that could be or that are addressed and they're not effective. Overall, I would say learning about health communication this semester, I've learned it's applicable to every single person. It's more than just what you see on the surface as far as being medically ill when you go into a doctor. It's the biopsychosocial side of communication that really affects how successful or unsuccessful a patient healthcare provider interaction goes.